Did you know that leukemia is the #1 killer of children by disease?
Well, that's awful. That's very surprising. I didn't know it was so prevalent.
I find it really shocking.
Surprising.
Yeah, very surprising.
At first, I wouldn't believe it because it's so awful.
I would be surprised by that.
I don't know, it's pretty bad.
Funding research for a cure is critical, but for a real philanthropic solution, we should not just be providing funds for research. We need to immediately help individuals and families financially when they need it the most.
You don't realize how much it costs just to be in a hospital for one day, and you don't even know how much it costs until after everything is said and done and you get the bill.
And the Leukemia Research Foundation has always been there to help us out with our prescriptions, our co-pays at clinic, and then obviously any hospital costs.
Bringing it local and just helping them know they're not alone. Because, it must almost just as hard for them as it is for their child.
It would be really important to see a local impact, to see that our money was going to help the individual people, at least in our community.
The urgency and how I hope I can find the words to encourage people to donate. This is when families are going through something like this, the stress and strain can be intense, especially if you don't have a support system. So the more support, the better.
It's an interesting thing. I don't think any of us think beforehand about needing to ask for money or needing to ask for help. But when I got hit with leukemia, all of a sudden everything that I assumed had fallen apart as far as I was concerned. So I didn't know, would I be working? Would I continue to be able to bring in income? Would my wife be able to work, or did she need to take care of me? What was going to happen for our kids? How do you pay the medical bills? What about all the things that the insurance doesn't pay for? Those are the questions that come through our mind, and those are the things that the Patient Assistance Program helps with.
We have events such as Dance Marathon, and we raise a lot of money for certain charities. And I'm not sure how exactly they choose the charity that they decide to sponsor or to donate to, but that's definitely a way that a large population of the Northwestern students could help.
Be a lot of legwork, like getting out the message to people, or fundraising activities.
Northwestern does Dance Marathon, which it's like the fun of dancing, but the point of it is to give money.
If you have a core group of people with a long-term commitment, then I think we could make it happen.
And we can make it happen, even locally, by uniting together today to enrich the quality of life of those touched by this truly devastating disease.
My name is Nick Shield. I have been fighting leukemia for 12 years. Although I have been lucky enough not to need financial assistance, there are many people that do.